Anxiety is a very common problem in all age groups and it is not considered as a mental disorder. Hi, I'm Dr. Vanaja Reddy. I work in Apollo Jubilee Hills in Hyderabad as a consultant psychiatrist. Today I'm going to speak about anxiety, which is a very common problem in most of the age groups. I see quite commonly in child and adolescent group, general adult patients and also old age people. So there is no age bar in having anxiety, and one should not feel that it's a mental disorder, and you should not have the social stigma or hesitancy in coming and seeking help with anxiety. Now, what is anxiety? Anxiety is nothing but few symptoms, collective symptoms of feeling stressed and thinking too much and deviating from normal self, and sometimes anger issues also come under anxiety. This is in generally felt by most of the people. Now, in child and adolescent, it's usually presented as agitation, and people also feel as anger, throwing up tantrums. So this is a common presentation in child and adolescent. Whereas in adult group, they present as more crying or having crying spells, feeling upset for small things which they used to not feel before, but now they are feeling upset for very, very minute things, and also getting frustrated with small things and agitated. Whereas in men adult age group, they usually show it as an anger. They come up as anger issues, and also very commonly it is experienced as sleeplessness. People come to the doctor for the sleep issues. I'm not getting sleep, and whereas I used to have a sound sleep before. This problem is usually a precipitant of anxiety. And in old age group, they usually present as crying spells. They cry for small things, and they withdraw from socializing, and they usually don't do the things that they normally do. This is the presentation in old age groups. Now, how do we come across this anxiety? It is very common and it's present in 80% of the population. Some present to the doctor and some don't present to the doctor, and they try to cope up with it, which is not good. I think if anybody has anxiety, or it is generally called a generalized anxiety disorder, this should be treated or this should be addressed at. Now, the simple way, natural remedies are doing yoga, meditation, pranayama and things like that, breathing exercises, and also keeping fit by walking or jogging or doing some gym or any other activities in the morning which keeps you fit. Even sports help in natural way of treating anxiety. So these are the natural remedies where you can clear anxiety. If it's a small problem, for example, if it's a mild anxiety, these can be easily dealt by self-treating. Now, when the anxiety is moderate and these natural remedies aren't working anymore, then I think one should seek the professional, either the psychologist or the psychiatrist. The psychiatrist first assess your situation. Once they feel that you need medications for anxiety, there are anti-anxiety medications that they would prescribe. At the same time, they would send you to the psychologist for counseling. There are counselings like CBT, that is cognitive behavior therapy, and so on. So while having the counseling therapies, you should be taking the medications as well. And once the milder form, the major severe form or the moderate form is transformed into the mild form, then that's when we can stop the tablets and continue with the natural remedies. In the same way, if the anxiety is severe, they present as panic attacks. Andolan, in Hindi they call it as Andolan, Gabrahat, Andolan. They are panic attacks. Their panic attacks are common precipitants of severe anxiety. Severe anxiety presentations are also quite common with us. So in severe anxiety, sometimes we admit the patient because they are unable to cope at home. It's always panic and sleepless, and they are unable to tolerate themselves shaking and sweating. So these patients, we admit them for a brief period into the hospital. We give glucose and give physical stamina things, and also give anti-anxieties in a higher level doses, anti-anxiolytics in higher level doses. So these medications and hospital admission bring severe form into the moderate form. Once they are in the moderate form, we discharge them and treat them in outpatient basis. Once the moderate form comes down to the milder form, they don't need any medications, and it's the natural way again to heal themselves. So this is a whole nutshell of anxiety. So in future, if at all anybody is having any anxiety symptoms, it's always better to approach the professionals.